Well, it's good to be back, and I have a question for each one of you, and that is, how did you become involved in what is now your profession? Each one of you. I like people's stories very much, and I think I have two wonderful candidates here. Kim, start out, please.
Actually, I started out in working at Cleveland Clinic, and I really didn't feel that I was being fulfilled there, and it wasn't rewarding for me because I didn't feel like I was helping people the way I wanted to, and that's really how I started out in public health. My degree is in healthcare administration, and when I left Cleveland Clinic, I went back to receive my master's in public health. And I volunteered where I currently work now. I volunteered there initially for several years before I actually was hired on as a full-time employee. And I wanted to make sure it's what I wanted to do, and it definitely is what I wanted to do.
Well, you're going to talk more about that, but
Right.
so you go ahead.
It's great to hear the volunteering was a segue. The free clinic was actually my first real job after college, and I went to school in California, and I've got some family here, so I sort of ended up in Cleveland coincidentally, and I got into the free clinic as the volunteer coordinator, and I stayed for a couple of years and started to really learn about public health. I had majored in urban studies and urban planning, so I was tangentially doing something related to improving urban conditions in the communities who live in urban areas. And then I actually left the free clinic for a couple years for another opportunity in fundraising and alumni relations, and then I was recruited back as the director of the volunteer program, and since then my position has expanded to also include external affairs and advocacy. So I've gotten LinkedIn, but it's been an exciting ride, and it's continually fulfilling now.
Uh-huh. And so each one of you, how long, Kim, have you been at Neon?
I've actually been at Neon. I was there for 2 years, and then I left and had a baby, and then I came back. So altogether, I've been there for 10 years, working as a full-time employee, but about 12 years, including my volunteer time.
Okay. And how about you, Melissa?
5 years, a little over 5 years altogether if you take away my 2 years away.
Well, that's a long period of time for my next question, which is, you've been there, each one of you, in your individual locations, long enough to be able to, I'm a historian, so you have to know, this is the way my mind works. What are the changes that you have seen, and what are the challenges that you see moving forward?
I would say one of the big changes that I have seen is, one of the biggest one is partnerships. That's a biggie now, that organizations work together that are working really towards the same goal, and that's to create a healthier community. So to do that, we must work together more. And I have seen that evolve really in a big way over the last probably 10 years. Neon has partnered with CASE to receive different grant funding. We've partnered with, as we said, with the Free Clinic. We partner with other community health centers that are located in Northeast Ohio, Care Alliance and Neighborhood Family Practice. We partner with a lot of the high school, working with high school students. So I would say one of our big ones is the partnerships have evolved because we're all working towards that same goal.
Well, many of them sound to me as though they involve fundraising. Are all of them? I mean, when you talk about a partnership,
Okay.
what does that? What constitutes the partnership?
A lot of our partnerships are grant funded. Now with the federal and state government and Office of Department of Health and Human Services, they really want to see partnerships, because what has, I guess, has shown is that there's been a lot of overlapping and we're not working together. And they feel we would be a much stronger force if we're in the same community, such as CASE and even Cleveland Clinic, university hospitals, and Neon Health Services. We've partnered with all of them. Currently, we're partnering with university hospitals on our mammogram program in the hair salons, and also with Cleveland Clinic. So those partnerships, we save a lot of money because we work together. So we're spending half. We'll spend half and you spend half, and we're both reaching that same goal. So it's not so much fundraising as it is grant funds. When we actually write a grant, we'll include them in our grant.
Mm-hmm. And Melissa, what about at the free clinic? How does this work?
I think similar to what Kim was saying, our community collaborations have been really paramount to us over the evolution of our 40 years of services. We were initially started by volunteers, a group of nurses and doctors, and to date we're still very largely reliant on volunteer providers in particular. We've seen a lot of our formal academic affiliations increase. We have about 35 formal partnerships with training programs in medicine, nursing, and dentistry, and behavioral health fields. So we've really increased our shift as a teaching institution in addition to a direct service provider for the community. We've seen a significant change in our patients, as I alluded to earlier, from going from more of an acute care focus to now serving as more of a chronic care facility and a medical home for many of our patients. And it's unique at the free clinic in that we have medical, HIV services, dental, and behavioral health all under one roof on one independent site. So we really focus on a lot of integrated and holistic care for our patients. And that's very different than the way the free clinic was 10, 15, 20 years ago, when patients would walk in, get anonymous care, receive their treatment, and we may never see them again. So our patient numbers have been somewhat steadier over the years because we're seeing an immense demand from the community, but we're really providing a significantly higher number of services per patient, whereas before it would be one service and done. Now we have the same patient that comes to us every 3 months and receives all their lab work, receives their pharmaceutical supplies, maybe is talking to a counselor, receiving dental exams and cleanings, and also having their medical chronic disease management needs met as well.
Mm-hmm. Well, it sounds to me like many of the needs of the community are being addressed. And my question for both of you is, from your vantage point today, where do you see the challenges?
Wow. Well, there are challenges. First of all, there's challenges working with the African American community. And that's the community that we mainly work with in the areas that we our focus areas. Some of the reason being, I'll go back to the Lance Armstrong Foundation grant. It can be difficult to get African Americans in to do different type of screenings and things of that sort. And it goes way back in history from a time when African American people were abused in a way to find out different medical illnesses or what have you. And so it can be very difficult to reach people, and a lot of people feel that they're being used or what have you. You know, and we come in with this grant funding and we want to make a big change, and then our grant funding is cut. And they look at us like, well, how could you come in and start this with us? For 2 years we've been going strong, and then you cut us off. So it can be very disappointing to them also. So we really try to leverage as much as possible and continue that relationship that we start with the community, because a lot of people in the community, they do feel that they're being used. So we have to break down that barrier and let them know that it's sincere what we're trying to do.
Right. I would say one of our greatest challenges at this point is our staffing capacity. And I mentioned we are very largely volunteer reliant, but there's a considerable amount of ebb and flow in that volunteer pool. We have a lot of professionals who donate 2 hours per month of their time. So we rely on a very large pool of people in a very intricately placed puzzle in order to provide continuous care for our patients. So we're continuously trying to recruit new volunteers, new talent to come in and support our patients, and the need from the community continues to increase. So it's always a challenge for us to be, marketing the free clinic and explaining our services and informing the community about what we offer. But then if a new patient were to call today, for example, as a brand new diabetic or patient with hypertension or high cholesterol, we're not scheduling new patients until the end of July. So it's a very long wait because we don't have the capacity and the staff in order to serve more patients. So we're really relying on Neon and the other health centers in the area to try and make those direct referrals and find places that can catch our patients, since we all kind of fit into that same catchphrase as a safety net provider in finding services for patients who do fall through the cracks of the health system. I'd say our other challenge quickly is also in funding at this point. As all nonprofits are facing, funding is always a challenge. And with health reform now, there's a bit of a misconception that, the problem's been solved and there's no more need for a free clinic. So, perhaps foundations or individuals will channel their monies elsewhere. So we're really trying to spread that message to our funding community that the access is still the challenge, that health reform is many years away from being implemented. And even when it is, if it, survives these threats of repeal, there'll still be a number of patients who need the free clinic, who don't qualify for services, who are still falling through the cracks in one way, shape, or form, and maybe fit into that broader underinsured category now.
That's very interesting. In other words, your success, what you're successful at, is not clearly understood when there's a change.
Right.
So, and say again how you address that.
I'm sorry.
What you were referring to before, what the challenges are, and what people experience as a result of these kinds of changes, when the funding. How do you handle that? I mean, that's very, I would say, challenging.
Right. Yeah. We have, fortunately, some very strong relationships with our funding partners, and we've gotten some direct feedback from them that they're in support of the free clinic continuing to operate and perhaps exploring different changes in our business model to be able to still meet the greatest need of the community, whatever that need ends up being, in light of health reform and potential changes down the road. So we're making sure we still have our allies in terms of our volunteers and our funders and our very vital community partners in healthcare as well.
Mm-hmm. Yes, I would say definitely the same thing, and those strong allies really mean a lot to us. And just trying to continue to engage the community. And one of the big ones for us is we're looking at the patient-centered medical home and really trying to build on that and trying to make the provider really work at building that nucleus for the entire family, that the entire family comes to Neon and get all of their health care services. As Melissa has mentioned before, some people will come in just for one thing, but now we're trying to get them to come back and get their dental care with us, their foot care with us, diabetes care, high blood pressure, whatever that might be. Even with the teenagers, we have a youth adolescence awareness program where we work with teenagers too. So definitely.
So reaching out, how do you get those young people to come in?
Oh, as I mentioned before, we have to go to them.
Yes.
Really, that's one of the big ones. That's a big challenge that we have, but we have found that we have to get out there and meet them where they are. We have a lot of partnerships with high schools, Shaw High School, and a lot of the high schools in the area that we work with, and that's our best way to reach them is go out there and get them.
Uh-huh. So you really reach out. That's
yes,
outreach.
we reach out.
You reach out. Melissa?
Same with us. We try and have presence at health fairs whenever possible. We rely very heavily on our volunteers as some of our strongest ambassadors to spread the word about the work we're doing. And we have a newly formed patient advisory council that's also helping us identify what additional services we need and how to better spread the word so that we can better serve the community.
Mm-hmm. Wow, this has really been very, not just interesting, but the energy that both of you have displayed and speaking about your two organizations and two agencies. Any parting words?
I would say that, first of all, thank you for having me. And I just want to say that Neon is very exciting in our upcoming years. We've been in business now for over 44 years, and we're just really excited to engage the community and just bring people in and continue to do good things for the community.
Mm-hmm. And if people want to reach you?
They can reach us at area code 216-231-7700.
All right. And Melissa?
And the free clinic, likewise, we celebrated our 40th anniversary last year, and we're planning for 40 more good years. Regardless of what happens on the political landscape, we'll still be here serving the community.
Aren't we fortunate to have you? What about if people want to reach you?
The free clinic's main number is 216-721-4010.
Thank you both.
Thank
Kim,
you.
Melissa, it has really been a pleasure. And your contribution to the community is really enormous, and I applaud you for everything you're doing. Thank you so much.
Thank you for having us.